On more cases, as I said it in my speech, we would expect more cases because, as you may remember, the index case, the first case in the ship was on April 6. And until the report was confirmed as infectious, that's around April 24 or 25. As far as we know, I think the passengers who disembarked have been located, and including one actually in the remotest place, and the UK had managed to reach through very difficult operations. And they're following up and also communicating with us. And the second question, of course, we should learn from this operation what has been done well and what were also the weaknesses identified, because there should be a constant learning and change should be a constant, improvement should be a constant, and I know countries see it that way. And that's why, by the way, based on COVID lessons, we're trying to improve the system. Several initiatives that we have started, including the pandemic agreement, by the way. But there are many other initiatives based on COVID lessons. And we can also learn from this and update and also recalibrate and prepare the world for, the better. On the safety protocols, of course, WHO has a clear guidance, and countries are expected to follow or to use. But at the same time, countries, based on their own assessments, they can make some adjustments because sometimes their local situation may need some adjustments. On the other hand, there is also the sovereignty, not only the adjustments based on local situations, but they have the sovereignty. So we can't force them to take our protocols. We can only advise and recommend. But I hope they will follow the advice and the recommendations we're making. Yeah, thank you, Your Excellency. On more cases, as I said it in my speech, we would expect more cases because, as you may remember, the index case, the first case in the ship was on April 6. And until the report was confirmed as infectious, that's around April 24 or 25, there was a lot of interaction actually with the passengers. And as you know, the incubation period is also 6 to 8 weeks. So because of the interaction while they were still in the ship, especially before they started taking some infectious prevention measures, because of the interaction, we would expect more cases because of some of what happened during the travel actually, until hopefully the interaction until April 30th. After that, of course, they have improved the measures. But the second part is passengers now have left and they're in their respective countries. So as Prime Minister said, the countries are taking responsibility and all the measures are being implemented by countries. Of course, as previously asked, earlier question, there are differences from country to country. This could be because of local situations. But at the end of the day, the countries actually take responsibility. And I hope they will take care of the the passengers, helping them to the best they can, and also protecting their citizens as well. That's what we expect.